In this chapter, we are going to discuss sleep. Infants can sleep up to 18 hours a day, so these are important decisions for both the infants and the parents. We're going to discuss how much sleep is enough sleep, different sleep patterns and techniques, the importance of developing a bedtime routine, and different products that you're going to be using.
Ricky slept maybe 2.5 hours at a clip when we brought him home.
A newborn baby from around birth to around 2 to 3 months is going to sleep anywhere from 10.5 hours to about 18 hours with no regular defined sleep patterns at all.
The thing that I was told was nap when he naps.
We try to sleep when the babies sleep, but that's sometimes more of a wish.
I had no idea how I was functioning with the amount of sleep that I had gotten.
Every baby's different, so when I say these babies are going to sleep 14, 18 hours, they're not going to sleep 18 hours at one time. They're going to be waking up throughout that. I'm just adding up all those hours in a 24-hour period. Different things can affect their sleep, such as if they're breastfeeding or bottle feeding, if there's light in the room, if it's daytime, nighttime, if they're going through growth spurts at that particular time and they just require to eat a little bit more frequently. Just keep in mind, don't get frustrated. Every baby's different, every sleeping pattern is different. You will eventually develop a sleep pattern that's best for you and your baby as they get older.
We put Ricky to sleep mainly breastfeeding, and then I would rock him in the rocking chair.
Bo has trouble falling asleep on his own at night. He likes to be rocked, or he likes to fall asleep during a feeding.
A lot of parents think they have to rock their baby to sleep, but it's actually a good thing to put them into their cribs awake. This way they can understand that it's bedtime and they learn to put themselves to sleep. Don't stress out. Not every baby is going to be able to fall asleep on their own. But in that case, you could pick your baby up and rock them to sleep. Just know that eventually it's a good idea to have them understand that they should fall asleep on their own while awake in their crib. There's certain things that you can do to help the baby understand that bedtime is coming soon. Establish a bedtime routine. Some of those things could be, first, a nice warm bath, then you can massage them a little bit. You can dress them in their pajamas, sing them a little lullaby or read them a story, dim the lights, and put them in their crib awake. A lot of babies will start to sleep through the night from around 6 weeks to 3 months of age. I know that sounds like a huge difference of age, but every baby's different.
Bo sleeps anywhere from 4 to 5 hours a night.
At uncomfortable times, teething times, maybe waking every 45 minutes to an hour sometimes.
Now, don't get nervous if your baby's sleeping beautifully through the night and then all of a sudden goes back to waking up frequently for feedings. Different things could be related to this, such as growth spurts. Babies might require more feedings throughout the night and the day. Your baby could be having developmental changes and growing. Also, as the baby gets a little bit older, the baby could start teething, and that could cause the baby to wake up a little bit more frequently throughout the night. Swaddling is a way of wrapping your baby up nice and tight and secure in a blanket so that they feel that they have boundaries, they're comfortable. A lot of babies actually sleep better while they're swaddled.
All my babies, when they first came home from the hospital, I swaddled them. You know, when babies are in the womb, they're all snuggled up. Their arms are up tight, their legs are close to them, and they like that position. So once they're born, they want to continue to be in that position for, a couple of weeks maybe. So you wrap them up, snug in a blanket, and it really calms them down. They're soothed, they relax, and eventually go to sleep.
I tried when I saw that the people at the hospital were swaddling him, but I noticed that he was strapped up so tight and he was crying, and as soon as you loosen the blankets and whatever else was in there, he was so much happier.
If you think your baby doesn't like to be swaddled, that's okay. Sometimes maybe you're wrapping them up a little bit too tight. You could try to loosen it a little bit, but not all babies like to be swaddled. Again, every baby is different. So you'll learn what your baby likes.
So some companies have made a blanket into a swaddler to make it easier for parents to swaddle their babies. The old-fashioned way is to just take a receiving blanket and fold it down and wrap it around your baby. A swaddler actually has, it's sort of a sack, and it has some Velcro on it so you can wrap it around your baby.
Now, when you're swaddling them, keep in mind you do want the blanket to be a lightweight cotton. The reason why you don't want to use too heavy of a blanket for swaddling is your baby could overheat in the blanket. So be sure to use a nice lightweight cotton breathable blanket.